Hello, my name is Patricia Prado. I am a doctor of occupational therapy, and in this module, we will be talking about home safety. In this presentation, we will discuss ways to modify the environment in support of fall prevention and a safe participation in daily activities. And we will talk about types of durable medical equipment that will support fall prevention. Dementia is progressive, so your family member will need more assistance with their daily care, and they may experience more difficulty with participation in daily self-care activities, and they may have difficulty in ambulation or mobility, which puts them at risk for falls. Your family member will be experiencing changes in cognition, such as decreased safety awareness due to confusion or disorientation. They also have difficulty carrying out tasks or following directions. So when giving directions or instructions, it's important to talk clearly and only provide one instruction at a time. Other areas that may be affected that will impact on safety is mobility. As we grow older, they may experience decreased balance or coordination, decrease in sensation, so they may be unable to feel heat or cold or unable to feel pain, and this affects the safety in their home. Your family member may also have decreased eyesight due to other underlying conditions or decrease in visual perception. This means they may experience difficulty with interpreting the environment, such as colors, patterns, and structure. Our first objective is to talk about ways that we can modify the environment to support home safety in order to prevent falls and have safe participation in activities of daily living, such as bathing, dressing, grooming, and eating. There are several things that we can do to modify our environment, such as reducing clutter from bedrooms and living rooms, removing scattered or thrown rugs and other objects that can be tripping hazards, keeping your home design and setup clear and simple, and we can also rearrange furniture to reduce fall risk. Like we see in the first picture, we see that it's a messy room, the rug is on the floor, the shoes are disorganized, we see a chair blocking the entrance or the exit of the room, and we also see that in the nightstand there's too much clutter and mess. These can fall and cause our family member to trip and fall. So we want to keep it nice and simple like we see in the second picture below, keeping the items that they use mostly and also increasing lighting in the areas that they are in. There are also other environmental modifications that we can do to other living areas, such as the living rooms, always making sure to remove any scattered or throw rugs that are near hallways or in the living room and bedrooms. You want to clear electrical cords from all areas, so keeping those electrical cords near walls or away from walking paths. You can also rearrange furniture, especially low coffee tables and other objects, so that they're not in the way when walking. It's also important to make sure that the sofas or the chairs your family member uses are the right height in order to get in and out of easily. And you should always be aware of your pets or any toys that may be on the floor and they may present a fall risk. There are some physical modifications that we can do in the home if you have any stairs or steps that they need to take. Using texture strips or non-skid wax on hardwood floors and tile floors to prevent any slipping. As we see in the first picture, those are some texture strips. On the second picture, we can see that they added some color to kind of give that difference in every step. This is very important, especially if they're having eyesight problems or visual perception problems. This helps them kind of differentiate a step when they're taking the step. So you can either paint them or you can add a bright tape to each corner. We want to eliminate uneven surfaces as well. If you have down steps and it's getting harder for them to walk in the home, you might add a little ramp or marking the steps in the home as we mentioned earlier. Adding light to illuminate area, this is very important, especially in areas that they frequently use, so hallways and bathrooms and in the bedroom. You want to make sure that if they're going to stand up at night and go to the restroom often, that the areas are well illuminated. Bathroom modifications. So a lot of falls happen in the bathroom because it's wet or the toilets are too low. So we can add in our home some safety equipment such as grab bars near our toilet or in our shower. And this will help them kind of feel more supported and safe. You can also replace your shower with a hand hose shower, and this decreases the need for them to be in standing while they shower, so they can do it in sitting. You can add some non-slip mats or raised toilet seats to prevent any falls. If they're too low, it's kind of hard sometimes to get up from the transfer surface. And using tub transfer benches or shower chairs. If you have a tub at home, you can buy a tub transfer bench, and this decreases the need for them to physically stand and transfer to the tub, so they can do it in sitting and kind of just slide in the tub. And we see that example in our second picture with the chair. In the first picture, it's also important to organize all their materials in a safe place. So all the things that they use on a daily basis. So that way it's a lot more simple for them to complete their grooming and hygiene in the restroom. We can also modify the kitchen area. So you want to make sure that you remove access to dangerous kitchen items. So knives or anything that may cause any danger. You want to make sure that you decrease clutter. Like we see in the first picture above, we see that everything is very organized, so it's a lot easier for your family member to identify the object that they may need. You can also label items, which makes it a lot easier for them. If they cannot determine what the object is, if it's written, it may be easier for them to know what it is and what it's used for. And you can also add cabinet and drawer safety if you want to store your knives in a safe place. Other things that we can do in our bedroom or living room areas that we can modify is adding door locks. Uh, your family member may experience a decrease in safety awareness, so they may try to open the door and go out. So it's a good way to kind of prevent that from happening. So we see an example in the first two pictures above. This is called a door guardian. You can also add alarms to notify when the door is open or the window. You can also add video monitoring outside just to make sure that you're knowing where your family member is in case they try to wander off. And making sure those electrical cords are covered. You may put them near the wall, or you can also cover them with a cover. Types of durable medical equipment. The first picture that we see is called a 3-in-1 bedside commode, and this performs 3 different functions. So it can be used as a bedside commode, a toilet razor, or a toilet safety frame. So you may place this above your toilet, and they can use the grab bars on the sides to help them boost up if they're having trouble. You can adjust the legs according to their height. The second one is the tub transfer bench. This is used for tub safety. So this comes out from the tub, so they're able to sit from the outside and transfer in, just sliding too. They don't have to stand up and transfer, which makes it a little bit harder sometimes. And the last one is a shower chair with a back. This helps to support them while they're in the shower. In summary, we have explained different methods of modifying the environment for ADL safety in our home, and we have discussed types of durable medical equipment. Thank you so much for joining us today.